Hello everyone, I am Dr. Ramesh Krishnan, and in this video I will make you aware about migraine and headache disorders. Do not ignore the symptoms of headache because it can present with some warning signs. Repeated headache is not normal, and so early evaluations is necessary to prevent the long term outcome, which can be a detrimental to the person who is suffering from. The symptoms include throbbing headache. It can be associated with nausea or vomiting. It is usually sensitive to light and sounds. These headache get aggravated with light and sound. These are also associated with visual disturbances in the form of blurring of visions and flashes of lights with blackout. So these are the symptoms of migraine and sometimes associated with different headache disorders. So if you're experiencing these symptoms frequently and repeatedly, consult to a neurologist can prevent the recurrence of this headache at the earliest stage. The common triggers which can lead to this migraine include the stress, loud sound, or some hormonal changes which occurs during the phase of cycles like menstrual cycles or some during seasonal changes or there can be genetic factors like family history of migraine. The persons can experience these headache disorders if it is prevalent in a particular family. So identify the triggers and avoid the triggers can have a positive outcomes and the headache management. What actually happens during these migraine and headache is that brain is oversensitive to a stimulus and nerve signals becomes overactive. It is because of brain sensitivities and nerves becoming overactive the patient experiencing throbbing pain, nausea, and have light and sound sensitivity. These are the common pathophysiology which leads to migraine and headache. Thus, the person experiencing these migraine and headache are oversensitive to stimulus, as a result of which they are sensitive to light and sounds, which leads to aggravations of their headaches. The management of it include medications to be started early, regular sleep, and stay hydrated. Proper hydration is also necessary to prevent these migraine and headaches. The management of it includes if you're experiencing headache, you should be aware of the red flags because if you're experiencing this severe headache, which is first time, the thunderclap, which means any headache which peaks within minute of its onset, headache with weakness or sleep problems, headache with fever or neck stiffness, or headache after an injuries. These are some warnings